the dominoes that come from trauma that we don't prevent and don't address, I think is a mile long of damaging dominoes. So it is a lesson of science, right? Not a lesson of opinion, right? But a lesson of science that this doesn't change in us unless we make it change. And it hides itself inside of us. But the good news is we can change it.
Paul, when most people think of trauma, they probably think of something pretty serious like sexual assault or physical abuse. And in your book, Trauma, you expand upon that definition quite a bit. So to make sure we're all on the same page here, let's talk about trauma from your perspective.
The first thing we have to do is really establish, like, what does that mean, right? Because the word gets used so often and in so many different ways that it almost has no meaning unless we define it, right? And the way that I think in clinically and to understand and help people, the way to define trauma that's most helpful is as anything that happens to us that overwhelms our coping skills and then leaves us different going forward. And this anchors not just to occurrences and changes in us that we can see in the world, but it actually anchors to the science. Right? That there are changes in us, which we can understand from the perspectives of neuroscience, that happen in our brain when our coping skills are overwhelmed. And then we see those differences as we move forward. So if we look at it that way, let's anchor it in the science that proves and shows the changes that happen in people as they then navigate life. Then the definition of trauma becomes, well, anything that does that to us, that makes that change. Now, a lot of the time, and in the most obvious cases, that's acute trauma in military combat, an assault, an accident, the death of someone, right? But those same changes in the brain can happen from chronic trauma and vicarious trauma. So the chronic trauma of, for example, being denigrated, being treated as less than, feeling vulnerable in the world, right? If that's happening to someone over and over and over, that person can have those same brain changes, higher levels of vigilance, lower levels of security, mood changes, sleep changes, just some examples of what happens on the other side of those changes. And we also, fortunately, as human beings, we have empathy, so we can feel for other people, which is in many ways a wonderful thing, but it also means we can feel their pain and their suffering. And there are people who have the same trauma changes in the brain from their proximity, their intimacy with other people's trauma. So trauma can be acute, chronic, or vicarious, but the definition in any of those cases is something that overwhelms us, overwhelms our coping skills, and then our brain is changed as we go forward in life.
The way you define that, it pops out at me. There's two different ways we can look at this, and I hope we can dig into each. We could get into the coping skills and how to build resilience before trauma occurs. And then we can also talk about it from a perspective of somebody who realizes they have trauma that's already occurred and how they can heal from that.
Yes, absolutely. I mean, I think as with anything related to our health, no matter what it is, prevention is always best, right? So looking at how do we prevent trauma, both by shoring up, so to speak, individual people and by navigating towards societal changes, right? That work against environments that are conducive to trauma, right? So prevention, I think, is absolutely most important. The more we can prevent, the better. But then, yes, the other side of that coin is, okay, now once it has happened, and it has happened to many people in the world around us. I mean, look at the distress and discord in our world. I mean, look at what came of the pandemic and, economic problems and racial iniquities. I mean, there's so many problems in the world around us that we've created an environment that has led to trauma for so many people and to these changes being present in them. So that begs the question of how do we identify it, understand it, and help to change the brain back to a healthier state.
Well, let's get into that. Let's start with some of the practical stuff here. And first off, identifying trauma. So I think we could take this two different routes as well. We can talk about from our own perspective, how do we identify if we've been through trauma? And then as a loving family member, friend, how do we identify in others? And then to know when we need to act to help that person out if they've been through trauma and maybe they're not recognizing it.
Right. There are kind of two hallmarks there, that we can anchor to. And one is, has something happened, right, that would seem like, hey, it might make change in someone, right? So as you said, say a physical assault, right? A sexual assault, a death, a bad accident. Those are things that say it doesn't automatically mean that the brain will have changed, but maybe, right? So to think about, hey, what happened in the person around that time? Is it something to inquire about? Like, hey, how are you doing after that, right? Is there anything you're noticing in yourself that's different, right? So we can anchor to events, but as we just talked about, not all of these changes come from acute events, right? So perhaps even more important is anchoring to change, right? So if you see that you yourself or someone around you is different, right, is behaving different. They're more avoidant, right? Their mood is lower. They seem more anxious. If we know them better, maybe they're not sleeping as well. They're making avoidant choices, right? Then that's an indicator that, hey, maybe, we don't know for sure, but maybe something has happened inside, and one could inquire about that, because maybe it hasn't been an acute event, but boy, it was the straw that broke the camel's back in the chronic racism or sexism or gender identity discrimination, whatever that person is going through, right? And maybe the straw that broke the camel's back was sometime in the spring, and then you notice, hey, that person kind of started seeming different sometime in the spring, right? So then you're inquiring through the lens of, no pressure caring about the person, right? So you're just bringing to them, hey, observations because you care about them. And we can do that with ourselves and with others. And often that starts a conversation, because the biggest problem is that trauma reflexively generates a sense of guilt and shame. And then people push it under the surface and they're not communicating about it. Often not to other people, but often not to themselves. I can't tell you how many times I've sat with someone who knows something changed them, but they're not acknowledging it even in their own mind. Even though sometimes I'm seeing them because, hey, they're having some problems. Sometimes I'm seeing them because they're having life-threatening problems, right? And the reflex guilt and shame and avoidance of the problem because the person doesn't know how to fix it and is afraid, if I start thinking about it and talking about it, maybe it'll get worse, right? So the person often is never even acknowledged to themselves that this has happened. So to generate thought, reflection, conversation is so important. Otherwise, we take something that can be really helped and we shove it under the surface and ensure that it's not going to be helped.
And Paul, as a practicing psychiatrist, over 20 years working with all kinds of different patients, how often would you say when you're working with somebody with a mental health challenge that trauma is somewhere intertwined within that problem?
Very, very frequently. And look, that's why I wrote the book that I wrote. And it's why I see the world through the lens of trauma, is not because I decided to, right? But because I noticed over time that, oh my goodness, like 60, 70, and ultimately I think around 80% of everything that I see, right? And some of what I do is clinical work across the spectrum. Some of what I do is coaching and consulting work. So whether it's a mental health problem, mild, moderate, or severe, or it's just a challenge someone is facing, right? So many times the roots are in trauma, often the roots of addiction, the roots of panic attacks, the roots of depression, the roots of sleep disturbance, and often the roots of physical problems, right? We know that at least half of all complaints brought to physical medicine doctors, so all doctors other than psychiatrists, right? General medical doctors treating physical health conditions, at least half of what's brought to them has a mental health origin, right? So you think about how the trauma and the mental health symptoms it creates can then drive us towards cardiovascular disease, so heart attacks, strokes, drive us towards diabetes, drive us towards autoimmune problems. Like, we know that these things are true, but we turn a blind eye to it. So what's interesting is, in many ways, it seems so obvious to me, right? If more than half of the problems brought to physical medicine doctors are coming from a mental health origin. And what we see over and over and over again is the role of trauma in the mental health issues. Well, then we have to look at trauma if we're going to help ourselves from all perspectives, including how we behave in society, the societies and cultures we create, which are aggregates of all of us and what's going on inside of us. I really and truly believe, and I think the evidence, the data is there that points us towards trauma as being behind the majority of those problems.
So we've talked a lot about different symptoms, signs that somebody might experience if they've had trauma in their life. We've talked about different manifestations of different diseases, but let's talk about the brain specifically and what happens there on a physiologic level, the changes once we've experienced trauma.
Yeah. The brain shifts into a more defensive mindset, so to speak, right? Which if you think evolutionarily, makes sense given how humans evolved, right? It makes sense in the context of survival, right? So the idea being, let's say we all live in small tribes, right? And I come across somebody from a tribe next door and that person attacks me, right, for some reason or another, then for me to now feel more vigilant, more defensive, avoidant, right, in a way, it makes sense from the perspective of survival. But we're not, 10,000 years ago in human evolution, right? We live much longer. We navigate complex social systems around us. So going to a place where we become more vigilant, we become avoidant, right? We stick more to what we know, even if what we know isn't so good, right? So someone who's like, I really don't like my job, right? Or the relationship I'm in, like, this isn't going well, or maybe it's even abusive, right? But it's more likely then the person says, hey, I don't, you know what? If I try and find another job, that could be worse, right? Or I could find another partner who could be worse, right? Than this. And then people then tend to shut themselves down, right? And to choose the pathway that doesn't bring any risk, even if a little bit of that risk, right, could go a long way towards making a better life, right? So one example, and I think to me, it's the most, outstanding, like most compelling example of change in the brain, right, is how the brain changes in its response to new faces, right? So the idea being, if I have not had trauma that overwhelms my coping skills and makes these changes in me, right, that if I don't know you and we're just walking down a hallway or a street in opposite directions and I see you, then it's more likely I have a curiosity, right? Like, especially to say we're in a social situation, an office or so, that like, oh, like, do you seem pleasant? Are you smiling back at me, right? I'm interested in you, right? That's a natural human thing if there isn't trauma. The changes in the brain make a very different approach, right? And it's an approach more like, are you going to try and hurt me? Do you mean ill to me, right? It's a much more defensive mindset. And like, think about what that extrapolates to, right? It extrapolates to not meeting new people, not doing things, say, in a work environment that can make for better performance or more enjoyable work, lead to promotions, right? Or someone who wants friends or a relationship, it doesn't lead to meeting new people or dating new people, right? I mean, there's a very shut down aspect of that then pervades the person's whole life. Like, it's not good to see novelty, right? Novelty in other humans from the perspective of like, do you mean me harm? Right? So you can see how these changes in the brain, and we understand structurally like a lot about what parts of the brain are involved, right? But there's a whole shift towards defensiveness, which is really about survival, but that's not applicable, in the modern world that we live in, to then have how we interface with the world around us change so much.
Talk about how trauma actually influences our memories.
So trauma can change our memories, right? And so what do I mean? What do I mean by that? And so what I mean is that our memories in and of themselves don't have meaning, right? Our memories come alive and have meaning when we attach them to emotion. Right. So I don't know if you and I did something fun together, right? We went at a good time. If I just think of that, it's all it is like a black and white narrative until it gets enlivened with emotion. right? And then the emotion like, oh, right, like that was great. I had a good time. You feel warmth, right? It's the emotion that makes the memory come alive. So if you imagine, it's just a metaphor that there's like a little flag attached to the memory, right? That says, oh, how do I feel about that, right? And then the flag changes, right? And I give examples in the book. So for example, a woman who went walking with her husband in parks and loved parks, loved the grass and the trees and the lakes. And then tragically, the husband died during one of the walks, right? Now her memories to do with parks or to walking with him, I mean, thousands of memories, thousands upon thousands have a different flag, so to speak, attached to them. And now they bring hurt and pain, and she could think, I don't like those places, right? Like, so all the positivity, all the warmth, all the goodness of those memories then can go away, right? So trauma, it creating reflexive guilt and shame in us. And by altering our memories can change our entire interface with the world. And if I could give another example, which I think is one of the most classic, it's a real example of a young woman who, when she was younger, so she wins an award. So back in high school, that's like a pretty good award to win, and says like, hey, like she's pretty smart, and she achieved that, when maybe that wasn't even expected of her, but she went and did it, right? And it tells her like, I can go out and make my way in the world, and like, look, I can make a good life for myself. I have a good job and a partner. Like, I can achieve things, right? So then after a trauma, so after an assault, like something bad happens to her, right? Then there's a reflexive guilt and shame. She feels responsible for it. What did I do wrong? Why didn't I see it coming? Right? Oh, it's all my fault. She's an entirely different sense of self and sense of safety in the world, right? A reflexive guilt and shame. And that memory changes. And now that memory becomes bitter. It becomes a mockery. Like, oh, I didn't even deserve that, right? And right, there's the height of achievement in my life, right? Like, it's going to be that, right? It's an entirely different mindset about it that goes from being bolstering, right, to now being oppressive. And it fits with a new narrative that says, right, like you can't navigate the world, and you can't keep yourself safe, and you make bad decisions, and you can't go out in the world where you think you're going to get ahead, you're going to find good things. Like, I mean, think about how awful that is. How many life opportunities a person forgoes, how that pushes towards depression, right? Isolation, physical health problems, right? The immune system then is more likely to have dysfunction. Autoimmune diseases like lupus, for example, become more likely, right? So you see how the change in our memories unfortunately paves forward changes in our entire perspective of life and the choices that we make in life.
And I can see how that would cause a vicious cycle, because when you start thinking differently like that and making different choices and interacting with the world in a different way, you're going to have different responses, and it's going to reinforce those new ways of thinking. And it's going to continue to self-perpetuate until what you're thinking is actually what has become true of your world.
Oh, sure. All the time. The self-fulfilling prophecy, right? So if a person, say, who's been through an assault, right, then they feel guilty, they feel ashamed, they feel afraid, they're extra vigilant, they're avoidant, right? So they're not then dating, right? They're not seeking, and they're not open to new potential romantic partners, right? So that person who is attractive and says hello in a nice way, they avoid that, right? And then, you might talk to them a year, 2, 3, 5 years later, and they'll say, right, this just shows I can't have a relationship. Like, look at me, years, nothing, right? It proves I can't have a relationship. Of course, like when you avoid, you make the self-fulfilling prophecy, you feel worse about yourself. It promotes more depression, more risk. So what you're saying is it's absolutely true, and it cuts people off from human contact, right? From new human stimuli, which is why I think it becomes easier for, say, when people misuse social media to say, look, let's make alliances around something that is not healthy, like alliances around race, right? Right, and or alliances around socioeconomic status, immigration status, political views, right? Then it becomes much easier for people to ally. And not everyone does this, of course, but I think this is a phenomenon we see, from Atlantic to Pacific in our country, right? It becomes easier then, because you're gating out new stimuli and new people, to say, right, like, me and people who are like me are better, right? Because there's a group of us and they think that, and like, that sounds good to me, right? Like because I feel bad about myself. And then they don't let in the new stimuli that's like, hey, actually, we're all people, right? And, you can find somebody who looks nothing like you or has a lifestyle nothing like you that has very similar value systems, right? And you can find points of alliance or agreement or even ability agreement to disagree, right? Without having to be vicious or to say, oh, like, you don't agree with me, you must be a terrible person, right? Like, that's much more likely to happen when people are shut down. They're shut down inside of themselves. They feel guilt and shame and a cognizance that they're not navigating life the way they want. And then people become more vulnerable to someone who comes along and says, I'll help you feel good, right? Feel good because you're this religion, this color, this sexual orientation, right? Feel good about that. That's what's going to make you feel good. And people become more susceptible to those lies because they're more lost inside of themselves and they're not open to other people the same way you see that new face and you think, are you going to harm me? Right? Does that make sense?
Yeah, no, that does. I want to come back to a specific example you brought up there, the dating example, and going on for 5 years and not meeting new people and reinforcing that over time. Say you're working with somebody like that, how do you begin to break that cycle?
Doing trauma therapy work is often very rewarding because people very often get a lot better, right? Because the whole construct, which is false, right? I think we can see from the outside, like, it's so obvious. If you haven't been open to meeting another person in 5 years, you haven't met another person in 5 years. Like, that's it, right? It doesn't say anything else about you, right? But from the inside, the person doesn't see that, right? So if you start to expose, like, what are the thoughts and ideas inside, and you start to expose it to the light of day, so to speak, right? And you start to look at it through the lens of trauma. So sometimes I'm saying something interesting like, well, it is interesting, right? I mean, you tell me you haven't had a relationship in 5 years, which is a long time to not have a relationship for someone who's interested in one. But you're kind of also telling me that you really haven't been open to meeting anyone. And in fact, maybe you've even been avoidant, right? Of people who like wanted your number or called you and you didn't call them back. And like, that's kind of interesting, right? Like, what might the shift be, right? And then what we're really doing, it's always, in a sense, there's always a sameness to it of giving that person, like, in a sense, permission, right, to talk about what's inside of them and reassuring them, because people say more times than I can count. People say, oh, I can't talk about that, right, because I'll start crying and I'll never stop, or I'll curl up in a fetal position and I'll never get up again, or, I won't be able to eat or feed, right? That's never true. That's not how that goes, right? That's the response of guilt and shame, right? And fear that leads the trauma to be sealed off, right? When what we need is the exact opposite. So if a person feels like they're in a safe environment, like I'm not looking to criticize them or to make them feel bad, right? I'm not looking to make them feel ashamed of themselves, right? Like, we can talk about whatever there is to talk about. And look, I really mean this, that sometimes a person will say something that they've never put words to, and they feel much better just for having said it, and the world didn't collapse. They'll say, I was sexually assaulted by a coach when I was a kid, or by a neighbor, or they've never put words to it and really made it real in that way for themselves. And then that can start a process, and often it does start a process of the person doing much, much better, because they learn, oh, I don't collapse when I say that. The person across the person in the other chair, me, isn't like, oh my gosh, I can't believe it. Or, I'm not responding that way, right? I'm responding in a way that's like, well, gosh, like, I'm sorry that happened. I mean, we can talk about it and what its impact may have been. And then the person starts talking about it. I became more afraid. I became more avoidant. I didn't really see the world the same way. And, that's when I stopped working hard. What my grades went from, A's to C's then. And the person starts talking, and then we can make an attribution of, well, what happened? And okay, so if you were a kid and an adult did that, like, it's, who's responsible for that, right? Because the person's reflex is often, I'm responsible, right? I mean, that's the hallmark of specifically of abuse of children, right? Is the child feels, how many people have I had say, well, it's my fault because, well, I went back to practice, right? I went back to school, right? And because they're not thinking, well, wait, sorry, what was going on in the 10-year-old mind, right? Often that they're afraid of the person. They're confused, right? They don't think they can not go back to practice or tell anyone, or maybe they did tell someone, but no one responded. Now, in the book, I interviewed Stephanie von Gutenberg in the book, who's an expert on child abuse. And I mean, it's a fascinating interview, I think, because she talks about how often children say what's happened and it's shoved under the rug, that they have to say it over and over again before anyone's really listening, right? So we could have societal changes that make it easier for people to bring their trauma to light, especially childhood trauma. But often what happens is it stays sealed inside of them, and then all that guilt and shame, and I'm responsible, and it's my fault, and I went back, and I can't keep myself safe, that's churning inside of them. It's spinning off symptoms, and it's determining life decisions.
Shame and guilt is something that keeps coming up in our conversation. And I'm curious, it's been well established now through our chat that is tied to trauma.
Yes.
But why is that?
I don't know. I mean, no one knows for sure, right? But having done this now for 20 years and, having read and thought about the literature behind it and even, human development, right? It's probably, I believe it's in the service of safety, that if you feel ashamed and you feel guilty, you're more likely to hide yourself away, right? Which probably in some context of human development made the basics of survival more likely, right? Now, is that person going to thrive? No, and certainly not in the modern world. The person's not going to thrive. But the response of just go inside of yourself, be vigilant, be afraid of the world around you, probably has some advantage if we're just talking about in the short term. Do you live long enough to reproduce, or do you live long enough so that you having reproduced, you get the children to a point where they can survive? Right? But that's not the point in the modern world, right? That is not adaptive in the modern world. But it's remarkable how that reflex of guilt and shame accompanies trauma. Like I'm hard pressed to think of any scenario where trauma makes those changes in the brain and there isn't guilt and shame along with it. And even in the book, I write about in my own life, I'd had no real trauma in my life. And then my brother died by suicide when I was in my early 20s. And at that point, as I think back on it now, and even at the time, so much changed inside of me. Like I felt guilty about it. I felt like it was my fault and I should have seen and I should have known, and I felt ashamed and I felt marked that I wasn't going to have a good life. And like I thought I was going to be able to navigate life. I couldn't even help my brother not kill himself, right? I mean, what's wrong with me? And there was so much of that change in me that I did not understand. I did not understand it, but I also wasn't questioning it, right? It was like, oh, now I know something I didn't know before, which is I'm incompetent. I should feel ashamed of myself. My family and myself are cursed and nothing's ever going to be good and right. And then my life decisions started getting worse. My mood got worse. My anxiety got higher. My sleep got worse. I started drinking more. And like that was not going in a good direction. And I see how those changes happened in me, that very classic changes of guilt, shame, avoidance, vigilance, shutting down life options that I've seen more times than I can possibly count across 20 years of doing this as a career.
And I know part of your life story is transitioning from the business world into becoming a psychiatrist. I'm curious, at the time of your brother's death, where were you along that trajectory?
Very contemplative, right? Because there are many aspects of guilt and shame and how they can manifest in us. And, for me, the thought that I would leave the business career that I was in and like I'd have to go back to college, right? I'd graduated from college, but I didn't have any pre-med classes, right? And then I was going to stop making the good income I was making, in my business job. And it was going to cost money. And I'm fortunate to have loving parents who then, would have costed them money because they'd likely want to help me. And, I had a sense of guilt and shame about even the changes I was contemplating in my life. So, so traumas can happen in big ways, like, the big impact of the loss of my brother. But even that was an example of sort of the chronic trauma of like, I was supposed to do everything right. And my career that I chose was supposed to be the right career. And I wasn't supposed to have quote unquote wasted time in college studying things I wasn't going to do now. And there were a whole set of constructs in me that were keeping me in a less than optimal place and in really what ultimately was not a very healthy place for me. And it was the huge trauma of the loss of my brother that really had me then get some therapy and start really looking at things again. And I remember going and seeing a therapist and even feeling embarrassed about it. Like, oh my gosh, I need therapy, right? Like, cause I was raised in a way that people didn't go to therapy and like, cause what is this going to be like? And then like, there was a nice skilled person who helped me reflect on like what's going on inside of me. And then she started calling attention to in a gentle way, but in a way I needed to hear that, yeah, like the problems in you after the loss of your brother, but the problems in you unrelated to that too. Right. And then I started to think and learn more.
When your brother passed, were you already thinking of a career in medicine and kind of in that, it sounds like you're in that decision phase of making a pivot?
Yeah, I was in the decision phase, but really held back by a sense of basically guilt and shame around making a career change, right? Which again, it's a different kind of manifestation of trauma, but perfectionism and anxiety and some of the ways that I'm built to putting those pressures on me wasn't giving me the latitude to say, hey, you don't like how your life is going, and you're young and you can change that, right? Like go change that, right? But I know I don't know without the loss of my brother if I would have gotten there. I just don't know. I mean, essentially how things happen and evolve in our lives. But boy, it was a wake up call to me to what was going on inside of me and how much of that I was shoving down. Like I didn't want to accept that I felt guilty and ashamed that I didn't want to do the career I had chosen, or that I might want to go get more education and stop earning an income. And like that so paled in comparison to the guilt and shame I felt after his death, right? That as I was addressing the guilt and shame after his death, the other things I was feeling about myself kind of came along, and I was able to kind of, I think, write my life course.
You addressed what I was getting at and curious about, the fact that when he died, was that a catalyst for you to move into medicine and finally make that push and drastically change up your life?
Yeah, because I think it shed light on not only there were things I needed to, of course, to process and to grieve after the loss of him, but the immensity of that, and then it leading me to really reflecting about myself and engaging in therapy, then helped me see so much more about myself. Right. And to see, right, I'm prone to reactive guilt and shame, right? If I'm not behaving or doing the way that I think I should, or it's pleasing to other people, or people can be disappointed in me. Like it really had me reflect on that and say, actually, it's quite simple. Like I want to try and do something different. I can. I'm young, I'm unencumbered. Let me go do that. I'm going to go back to college and take some pre-med classes and see where it leads. And, it gave me more options of how to navigate the world without a reflex of guilt and shame, because we can be sort of set up for a negative impact of trauma depending upon characterological sort of genetic or nature aspects of ourselves or nurture aspects of ourselves. So being built with a lot of anxiety and perfectionism and raised in a way where the thought was like, oh, like I always do well, I get good grades, I make good decisions, right? Didn't give me latitude to say, hey, I think maybe I made a wrong decision and I want to change something, right? So it helped me understand that I was built in a way that made me susceptible to some of the smaller, the more chronic aspects of trauma, really taking more of a toll on me.
Going through such a stressful situation, I have to think you must have been, at a situation where it could have went either way. I mean, a lot of people just crumble in situations like that, and you took that inertia and used it to make a powerful change for good in your life.
Yeah, I think that leads me to how just I don't know how to better put it, like terribly upset, I feel, about the lack of social support mechanisms that we have for people who have been through sometimes really big traumas. A catastrophic loss, an unexpected death, a terrible assault. And, we don't really provide much help. I was fortunate that I had really good people around me, family and friends who cared about me, who were nurturing me, providing a support structure. And I'm fortunate that there's a fair amount of just resilience in me. But should that be deterministic? Like, well, if someone doesn't have as much natural resilience, they don't have as many people around them, their life just doesn't go well, right? And I see this where people are, decades into living in a way that's not really what they want or wanted or for themselves. And, and they're having what's called role underperformance, right? They're not doing as well in life as they want to, as maybe they're not as good a parent, or they're not as good a partner, employee. They're not exploring life the way they want. And we really don't help people enough. I mean, think about what we spend resources on, waste resources on, in the society around us, and we ignore some of the basics that upon which can be built either much more human happiness and much more human productivity. I mean, it's not about economic costs first and foremost, but if you think about just economic costs of if we supported people better, help people have the lives they want to have, people are more productive, right? But just like we often ignore infrastructure until that bridge is falling down, right? We ignore, it's easy for us to turn a blind eye to what is going on in society around us and say, oh, gosh, another school shooting. Let's have a prayers, right? And I mean, no, like, how about we cry for weeks about the children that were killed, and we stop and think about what is the cascade effect on that, on the parents, on all the relatives, on the community, on the teachers. How much trauma are we then kind of shrugging our shoulders about? And, ultimately we move on with life. And we're vulnerable creatures as humans, right? And traumatic things take a toll on us. And I think it's remarkable how careless we are, with ourselves individually and as a society. And I think our lack of response to trauma really is a hallmark of that, of turning a blind eye to things about us as human beings, us as a society, that are so immensely important. Then I think we have yet to even start to grasp the cascade of damaging dominoes of people who don't have the lives they want, people who become addicted, people who become angry and violent, people who then ally their lives around hatred of others, people who act out in ways that disrupt society, people who are sad and depressed and can't take good enough care of their kids. I mean, the dominoes that come from trauma that we don't prevent and don't address, I think is a mile long of damaging dominoes.
And I'd have to assume one of the challenges with trauma is that a lot of people can push through for long periods of time and build up, different traumas and having chronic trauma, because humans are pretty resilient as a whole. And you mentioned things like, sadness, depression. There's probably so many people out there who basically over time, their baseline just slowly trickles down and down and down. And because they're resilient, they're going to push through for a lifetime and unfortunately live such a less life than they could if they address that trauma.
Yes. Right? Yes. And I think, yes, we're drawn to the more dramatic, like, oh, after the trauma, that person died of an overdose, right? I write in the book how when people under my care over the years have died, I would think of what's on the death certificate versus what they really died from, right? And that person died of a drug overdose. That person died in a car accident. And I'll think, that person died from the rape 10 years ago. That person died from the child abuse, right? I know, because if I know them, what they were fighting, what was behind that dysfunction in them, what was behind the misery in them. And even then, when it's that clear, we don't really pay much attention to it, right? How could we prevent that? Are there other people in that situation? Or do we just look at, like we often stigmatize drug addiction, right? Or do we go and look at like who decides like that's the way they want to live their life? Do we look at like how did that come about? How can we help someone? So we don't even do it in situations like that, let alone situations where the person's life has been or is being less than it could be. They're unhappy, they're depressed, they're not enjoying life. It could be so much more for them. They could be so much more to themselves and to the people around them. How are we really going to pay attention to that if we're not paying attention to like bridges half falling over and people who've had terrible trauma that we're not so sure we want to give resources towards? Like you think about people who lost someone in 9/11. I mean, is there a group of people that we as a society could rally around more? Right? But even there, like, are we really providing a lot of resources, and well, then there's arguments, political arguments. Should we provide more? Like, we can't wrap around them, right? How are we going to wrap around people who haven't lost someone, in a terrorist attack, right? I mean, we're not even adequately helping people in a situation so big and attention capturing for us as a society as that.
Well, let's take that example. Somebody that lost somebody in the 9/11 attack. What would conventional treatment look like? You've talked about and touched on the fact that it's pretty abysmal, but say somebody went to a conventional, therapist or psychiatrist, what kind of treatment could they expect?
I apologize, but to really answer that question, we've got to go to before the question, right? Like you said, well, somebody goes and sees a psychiatrist, right? I mean, that's not a given that a person can just go do that. I mean, we live with a broken healthcare system, right? We live with a healthcare system that is designed for throughput, that is designed for quick fixes. It's why we use approximately 5 times as many medicines as, say, people in certain Northern European countries, right? Because the healthcare system is more involved in how are you taking care of yourself, right? If you're overweight and you have diabetes, can we talk about your lifestyle, right? What human things would you do? What about diet, exercise, right? How do we help you be more responsible for yourself, right? We look much more for short-term fixes, which unfortunately we do in a lot of ways in this country. So we throw medicines at things. We look at, okay, if you have some problem and you have some symptoms, right? So if you're lucky and you have insurance and you can get an appointment with someone, right? And after you wait so long, now you have a brief appointment with somebody who likely has way too many people to take care of, right? And what they're then looking for often, and again, I'm not trying to criticize the practitioners. I mean, most people are practicing in terribly broken systems, right? Then those systems often look to say, well, what symptoms do you have? Right? So, okay, wait a second. You have some depression, okay, and and you're not sleeping well. Okay, so that's what lodges in. Okay, I can give you a medicine for your depression. I can give you a sleeping medicine, right? Write some prescriptions, then you go out. Like nowhere in that is actually understanding you. Right? And again, I'm not saying that no one does that. There are very good practitioners who, of course, will try and do that. But how much of that are you really going to do in, say, follow-up appointments, often 15 minutes? How much are you really going to catch up with someone? There's like several thousand people on somebody's patient panel. I'm going to see you for 15 minutes down the road enough that I'm not going to really remember who you are, right? And I got 15 minutes to do what? Take a stock of your symptoms and then adjust a medicine dose. So the idea that now somebody shows up in front of someone who's really going to pay attention to them, we've made a lot of leaps of faith that often do not happen in our healthcare system that wants to say, well, it wants to polish the hood instead of looking for what might that problem be in the engine, right? But if someone does get in front of someone, then you're looking for, is there someone you can have a rapport with? Someone who seems genuinely interested, someone who makes eye contact. I mean, no one's supposed to know all the nuances of the therapist's training and their approach, right? You might look at that, but we're not, a person who's not in the field isn't supposed to be able to assess all of it, right? Which is like, okay, because there's a lot of ways to come at it, right? And what really makes the difference, right, is not, one approach versus another in most situations, right? It's, can that person establish rapport, right? Which is complicated, right? Which means, can that person make eye contact, be genuinely interested, express genuine interest, help that person feel comfortable, they're in a safe place, they can allow even thoughts into their mind they might not have allowed before, right? They can say things, they can explore things. That's what we're looking for from treatment. And sometimes, sure, medicine sometimes help. I mean, if someone just is not sleeping or they're so depressed, they're having suicidal thoughts, and of course we need to intervene medically too, right? But the idea is to first even understand that there's a problem, right, inside, oh, something happened to me, or I'm different than I was, right? That's the starting point. And then being able to communicate to people, which might be friends, family, clergy, someone who's trusted along the route of potentially getting in front of a professional and being able to have the kind of conversations that we're talking about. But it's not easy in our terribly broken healthcare system.
Coming back to an example you gave earlier, you kind of alluded to what treatment might look like with somebody that's been through trauma, where you're kind of picking apart and looking at these cycles that they've got caught up in over time,
right,
and having them vocalize and express what they've been through, and have somebody there that can, again, you mentioned looking in the eye, and somebody that they can form rapport with and share these experiences, right, and vent them. But is there anything more to that picture? What is somebody going to get with treatment that's above and beyond conventional treatment?
Oh, sure. I mean, there's a lot more that can come with that. So there can be examples. There can be thought redirection skills, right? Coping with strong negative emotions, right? And still maintaining effective behavior, right? That could be another whole set of skills, right? So there are a lot of specifics that can be applicable in specific situations, right? But I am a huge believer. Why? Because I've seen over and over again how helpful it is to just help someone understand something. Right? Just help someone understand. Why is it that after that assault 6 years ago, that person has run over and over again in their head maybe 100,000 times, it was your fault, it was your fault, when somewhere in their brain they know that it wasn't, right? And if you can help someone understand, this doesn't mean you're crazy that happens. That doesn't mean you're hopeless. That's what people will say, right? What's wrong with me? How sick am I? It was crazy. And it's look, that's normal. That's what happens in humans. What gets called psychoeducation. You help people understand what's going on inside of them. And then, it becomes less frightening because we're very frightened of mystery, right? And if there's something going on in us that's frightening us, right? I'm so different, and this narrative is running around in my head, and we get very frightened of that. What does it mean? Am I really sick? Am I, people don't understand. And why would we, right? Why would we understand without somebody helping us? And yes, there are other things to do that can come of that. But I think as a first step, help people understand. The conversation we've been having, imagine, an aspect of this conversation happening in a clinical setting where someone comes in, is kind of aware that my mood hasn't been the same. I'm not a good partner. I'm not taking care of my kids as well. I just feel lousy. I'm hiding myself away. They know that. They know something happened. They know they're different inside. Their self-talk is different. They don't know why, and they're terrified. Right? Oh, and by the way, it's been going on for 5-6 years of dysfunction where they make all those self-fulfilling prophecies we've been talked about. I mean, think about how helpful it can be to have a conversation like what we've been having, right? Which I do lots and lots of times. And it may lead to using other strategies and tactics, but the basics of understanding, people are oh my God, think about what I understand now that I didn't understand before. That's so powerful. And again, there's no time for that in a broken healthcare system that just is, okay, well, tell me, go do this. Okay, go take this. I mean, that's not understanding, right? And that doesn't help people. And again, I'm not saying that mental health clinicians never help people, but boy, when they're trying to help people within the systems we've set up, the clinician and the patient are swimming against a very strong current, right? That is a current designed to just wash them down the river of the trauma continuing to have that same or worsening effect in their lives.
Part of what I'm hearing you say is people are expressing themselves and sharing these past traumatic experiences, and you're helping them reframe them.
Yeah. Right. The goal is reframing in the service of empowerment, right? I'm glad you used the word, because sometimes reframing will be misunderstood, right? The idea is, oh, look, you're going to help me see something from a different perspective that just makes me feel better. And he's like, no, that's not what we're trying to do, right? It's in the service of truth. So if we're reframing to what is true, right? From what may have been going on in your head, that you, the 10-year-old, are responsible for having been assaulted, right? Or me, the 25-year-old, is responsible for my brother's death because I didn't know and see what was evolving in him, right? And the reframing is towards, well, let's look at what's actually true, right? And that can make a huge difference, because it's reframing in the service of empowerment, right? You're not the one responsible for that assault. Like, you're living your own complicated life and trying to sort your own life out. And I lived apart from my brother. Like, I'm not supposed to magically see what he was working so hard to hide. Right? And then, it shifts in us in a way that is empowering. Like, oh, I'm not some cursed loser, right? Who didn't see what was going on in his brother. I'm kind of the person I thought I was, right? Except, like, things are complicated in me in a way that warrants me paying more attention to, right? What a frame shift, right? And it's a frame shift in the service of truth, and it is empowering. And that's why we often have people talk about their life narrative, talk about the self-talk in their head, right? Because that's how people start exposing to themselves the truth of the story, right? And that's why so many people get better with trauma work. Like, this isn't esoteric. From the first thing you and I have talked about, which is, it's not like, oh, I think everybody has trauma, it makes us sad and we should be nice to everybody. Like, it's not some bleeding heart concept, right? It's a concept based in neuroscience and based in clinical medicine, right? And it is also true, and it is based in tangible experience and tangible data, that when people have the opportunity to understand themselves better, to do trauma work that involves the understanding and the reframing and the coping with emotions, well, guess what? Most people get a lot better.
I wonder how much of people's problems when it comes to trauma is this busyness, go, 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 always connected in the 21st century, and just really not slowing down and taking time to process life and what they're going through, and taking time to think.
Absolutely. Look, absolutely. I mean, I can't respond strongly enough yes to that. And look, that works two different ways. One way is the world around us often imposes 24/7 stress, right? When you look at, you see sometimes these studies where like someone will go look at a tribe that's still living in a way we think is very primitive, right? They don't have anything. They don't have electricity. They don't have cars, right? And lo and behold, what do we find very often is that they're happier than we are, right? So you think, well, wow, right? And often how that parses out is there's more downtime, right? That sometimes, of course, there are things to worry about, right? But you kind of square those things away. Like, things are okay today, and and like what needs to be done has been accomplished for the day. They're not worrying about, is someone going to lob a nuclear missile here? Is my 401k account going to go to zero and I can't retire? Is someone going to open fire in the schools where my kids are, right? Like, it's over and over and over and over again, the stimuli in us telling us to worry and be stressed right now, right now, right now. Go click on the news again and again and again and again. And like, how is that not going to drive us to some sort of frantic state inside, right? And then the other side of that coin is there's so many opportunities to avoid. They say, well, I'll just go back and I'll look at this, I'll go and look at this social media site, that social media site, go click through this or that. And then there's avoidance, where the person then has this thing going on in them, often that is terrifying them and menacing them. But years can pass of being too busy, too frightened. I got to deal with the stress of the moment, and I was going to try and get to the end of the day so I can sleep, so I can survive tomorrow, right? And you know what? If I have 20 minutes, let me do something with that so I don't have to think in the 20 minutes, right? I mean, the modern world is unfortunately very conducive to the expansion, sort of explosion of trauma, both in us as individuals, because as you and I've established, it grows, right? It creates a cascade of problems within us, and then also in society. And I often have this feeling that we're kind of running headlong, towards a cliff, and we're kind of going faster and faster as the world goes faster, and as we accumulate more traumas and more divisions as a society, and we less and less look for points of commonality and points of shared humanity. When I'm in my early 50s, and when I was growing up, absolutely, I learned about America as a melting pot, right? Like, that's part of what made us great, is people came here from different places, and there were different kinds of people here. And like, that's what was awesome about us, right? You have a very different idea of how the country sees itself now in a much more divided way, right? Of, are you like me or not? And if not, there's divisiveness. And obviously not everyone is like that, but there's so much more of that. And how we perpetuate trauma through how we handle ourselves as a society. I think we haven't even begun to see the magnitude. What it reminds me of is when I was in medical school, there was I never forgot this. There's a professor who gave a lecture about biostatistics, using statistics to understand, human health, right? And it was the curve of lung cancer or cancer deaths in men as men started smoking so much more, right? As people understood, whatever it was the 50s, 60s, 70s, and you saw it go like this, right? Whoa, look at that curve of more death, more cancer, right? And then they looked at what were the curves like when they started looking, because women started smoking later than men, right? For social reasons, right? And you could see there was data from when women started really smoking that looked like this, but then there wasn't more data. Right? But where that data was going to go. Of course, it went where it went. With women's curve of cancer deaths was the same as the men. It just occurred later, right? And you think how 100% obvious it was, the suffering and death that were on the way. And like nothing happened to change that. And I worry that, I believe that we're in the same place as a society unless we do something to change it. Because we have had many, many, many problems that create cascades of trauma. Some of them have been socioeconomic, right? We look at how many people are employed, but we don't look at how many people can't handle an unexpected $1,000 need and still keep their lives online. But we say, oh, great, people are employed, right? I remember before the pandemic, reading statistics, things are great because unemployment is so low. Oh, by the way, more than half the people who are employed, right? Like, millions of people can't have $1,000, $1,500. They need to come up now and keep their lives on the rails, right? Socioeconomic carnage, right? Medical bills, medical debt, sinking people, right? Then we have the pandemic, all the death, all the grieving, and we run ahead from that. We have the political conflict, the decrease in standards of civility in the world around us, right? And I think, how is that not this aspect of a curve? And we know where that's going unless we decide, like, look, we don't want that. Just like if we don't invest in our infrastructure, well, guess what's going to happen when more hurricanes come, right? Like, we're going to have more flooded cities, and like obviously, right? And like, why are we surprised about that? If a bridge falls down, or now there's flooding, it's like, right? Like, that's what's going to happen. It's predictable. Like, we can decide to pull together, allocate resources differently, right? Handle our lives differently, right? Look at for points of commonality instead of points of points of difference, right? But people have to feel safe. They have to feel that it's okay to do that. And, you're not so beleaguered that you need to jump to the divisive because you feel so afraid and vulnerable. So I know I apologize. I'm talking in a very sort of expansive way, but I think that we're at the beginning of this curve, that if we don't do something about that, I think it's as obvious as the curve for women smoking when you look back at the data about men smoking.
And given all those facts and the chaotic situation of the world in the 21st century, do you have hope for us?
I do have hope. Yes, I do have hope. I have a lot of fears and worries. It's probably obvious at this point, but I do have hope because, and the last section of the book is a section about how do we make things different, right? It's a hopeful section of the book. And it's not that just because you want to end the book with hope, right? It's because I really and truly believe that if we ground to principles that are sort of in all of us, that they're very simple principles that we have the capacity to understand, that's when we see shifts in people and shifts in social systems on smaller levels. So if you think about the lessons of history, right? We don't have to be a historian to know that the lessons of history tell us that, when people are fighting and are divisive, like bad things come of that. Right? War comes of that, destruction comes of that, death comes of that, right? So if we're reasonable with each other and we get along better, well, guess what? Like, medical care gets better, right? Housing gets better. Like the lessons of history are so obvious. And most, not everyone, but most people adhere to some religion or religious principles, but often they're adhering to religion through a lens that's not about the principles, right? Most religions share basic principles of compassion and kindness, right? So people who say, I'm an adherent of a religion, but they're not acting in accord with it, right? So can we acknowledge basic lessons of history, of what our religious beliefs actually tell us, right? The basic lessons of science and medicine that, like, guess what? Trauma that overwhelms our coping skills changes our brains. Like, I'm not making that up, right? The scientific data is there, and we can acknowledge that and we can help that. These are basic lessons, including like lessons from kindergarten, right? Of just like the golden rule, like how about be reasonable to other people, right? When I see behavior like elected political representatives, like U.S. senators, right, or a U.S. president in our recent past, are behaving in ways that would have gotten you suspended from like middle school, right? Like, what are we allowing amidst us, right? What are we role modeling? Right? We're role modeling anger and aggression and bombastic behavior so that other people will align. Right, I can't behave that way, but I like that this person can. Right? I don't want to sound like some old person who's, oh my God, society's gotten so much worse, but we have changed standards of civility. And if we even went back to our just kindergarten models of how do we be civil to one another? How do we be polite to one another? I think we can make immense change by grounding to just those basic principles of religious principles, the lessons of history, what we learned in kindergarten, right? And I'm not saying that's easy to do just because the concepts are simple, but I think that's where our hope lies. It lies in common sense and common decency, and a lot of aspects of our society have strayed pretty far away from it.
And for somebody who is feeling the chaos of the modern world, and really who isn't, would you say a big part of this, you just described a lot there, is getting to the bottom of our individual trauma as individuals to help the collective?
Yeah, right, absolutely. Look, everybody, no matter whether we're carrying with us the changes of trauma or not, right? We could handle ourselves a little bit better today, right? So if I'm in a line, real story, small story, but in a line at a grocery store and I'm in a rush and the person in front of me like drops a bunch of change all over the place. Like, look, you can make a decision. Do you like scowl at that person? You're in my way, right? Or do you like smile and help them pick it up? Like, we can act a little differently today. We can be a little more kind to somebody. We can greet somebody with a smile. Like, that may sound like, oh, that's so nothingness, but it's not. It's not nothingness. So we can change our behaviors, including being nicer to ourselves. Like if I'm telling myself I'm a loser inside, can I like note that and like try and do less of it, right? Or like decide like maybe there's another voice in me that I could counter that with. So we can make changes today. But the answer to your question, what you said is still absolutely yes. Like if we're going to make real societal changes, then we have to work on the trauma, if there is trauma in us, and it's in a lot of us, or if it's not in us, it's in people we know, right? It's writ large in our society. Then that's what helps us be better for ourselves and others. Because if I have a reflexive guilt and shame that leads to avoidance and leads to an increased level of distrust and vigilance about other people, doesn't that make it harder to make my own life better and to make society better, right? Aren't I much more likely, if you say something that's diametrically opposed to some political view I hold close, am I much more likely to be like, okay, let's talk about that, or like, whatever, like we disagree, like so what? Like we can talk about it, right? I don't have to go to a place of anger, like you're against me and animosity, right? It's so hard to get along with one another, right? When we feel defensive and we feel beleaguered, right? And as you said, we can't stop what's going on in the modern world, at least not overnight, and that the news brings it to us. But what we can say is like, look, I'm going to understand myself as best I can. I'm going to take care of myself as best I can. I want to be as good as I can for the people around me, right? Am I aware that if I'm in a more state where, even for myself, where the trauma in me is more at the surface, I'm much more likely to snap at my children, right? Instead of stopping and being patient, right? So if I want to be the best person I can be to the people I love, it's worth the time and effort to try and understand myself better. And if we start there, then we start creating a domino effect of good things, which again, I don't think that's some Pollyanna, thing to say. I mean, I think that's consistent with the simple truth that I see evolve in people and in the systems around them.
For somebody who's tuned into this point and they realize they have trauma in their life that they need to address, how often can they do that on their own? And then how often do they need to see somebody like yourself or a psychologist to help them as a catalyst to get things moving?
Yeah, no, a great question. Some of it we can do on our own, but it's hard, right? There are mechanisms of assessing something for validity, right, that come online if we're making speech language, right? Which is why someone can have something running around in their head over and over and over without any change to it. But it changes as soon as they put words to it, right? That's not weird. That's like just how our brain works, right? So yes, a person can say, look, full stop, right? I want to just think about what's going on in me, right? Like, you know what? Here's the truth of it is I got in that bad accident 6 months ago. And like ever since then, I've been telling myself like, you're a loser, you hurt somebody, you're a terrible person, right? Like, I got to stop and look at that, right? So sometimes a person can use what's called an observing self, where you can look and say like, hey, what's going on inside of me? And do I need help for that? Or I keep telling myself I can never have a good relationship. Like, why? Is it because somebody hurt me? Right? Like, so people can do that. You can step away and observe yourself, but it is easier done if it's put into language. Now that could be journaling and then reading what you wrote, right? It can be talking to someone who's a trusted other person, friend, family, clergy, that kind of thing, right? It can work that way. So that can make a lot of progress. And for sometimes for people, that's the progress they need, right? Or it can gate them forward to, look, I really need to get some professional help, right? And even if I'm going to have to persevere to find somebody through whatever the insurance is, like I got to do that, right? Because I've got to get some help. Often it can go that way. But if there are things that are really distressing, like a person's having thoughts of not wanting to be alive, right? Or even suicidal thoughts, right? Or they're really depressed enough that it's hard to get out of bed or take care of themselves, or they really just can't handle the stresses of taking care of their kids, right? And they start to get to snap and get very, to maybe almost lose control, right? I mean, those are reasons to say, hey, get clinical help now. Right? Just because the helping mechanisms are far less robust than they should be doesn't mean that there are none, right? So if those things are going on, like those things warrant clinical attention, go get that help. And if you've got to push to get that help, go push to get that help, right? You deserve it, and the people around you deserve it. So yes, we can start sometimes inside of ourselves, or we can project in writing or speech to outside of ourselves, or with others, or professional help. There's a lot of ways to go about it. But I think the point I'm trying to make, and I think probably the point of the conversation is don't shove it down and do nothing. Right? And that's what it's telling you to do. The reflex of guilt and shame, in a way, it's the trauma protecting itself. It wants to stay inside of you, and it wants to not have anything change because it doesn't know, that this isn't like, we're not living in caves and trying to not die, right? Like that's not what's going on, right? But the trauma is trying to, in a sense, protect its place inside of you, and it becomes very easy to be avoidant or to be ashamed or to continue that negative narrative inside. So that's the easy path, moment to moment, but that's a brutal path across time. And, there's a time when I was still a resident where I started doing a lot of work in nursing homes, and it really opened my eyes because I would sometimes be talking to someone who's, in their 80s, and I'm thinking, wow, Like they have the same trauma problems in them that they've had for 40, 50, 60, 70 years, right? And even that was a long time ago, and I was still in training, right? But seeing like, oh, this doesn't change, unless we do something to change it. And that is an important point because the emotion systems inside of us don't care about the clock and the calendar. Okay, so think about that. There are logical systems in us and emotion systems in us. And when they come head to head, the emotion systems always win. And I'll give you the basic example. Is it ever logical to run into a burning building? No, right? Someone you love is in the burning building, you're sprinting into the building. Doesn't matter what's logical or not, right? When emotion and logic come head to head, emotion wins all the time. Right? And emotion, those systems don't know that time passes, right? You know, many times I've heard someone say, well, it can't be that. That happened 6 months ago, or that happened 60 years ago, right? Well, the part of your brain that's lost in guilt and shame and fearfulness and avoidance doesn't know that it's 6 months ago or 60 years ago and doesn't care. Right? So the problems don't solve themselves. They stay in us, and they can stay in us across the lifespan and bring all sorts of risk to us, from risks of suicide to risks of diabetes, from risks of underperforming in the roles towards people we love to having a heart attack, right? They stay with us across the lifespan. They change how we communicate, how we convey our genes even years down the road. I mean, think about that. There can be bad trauma now, and that person becomes a parent years down the road. So we're not talking about like a woman who's already pregnant, right? We're talking about a woman who may get pregnant years down the road, and that trauma changes how those genes are passed along, right? So it is a lesson of science, right? Not a lesson of opinion, right? But a lesson of science that this doesn't change in us unless we make it change. And it hides itself inside of us. But the good news is we can change it. We can change it in ourselves. We can change how we are then towards the people we love, and we can change our societies. But we got to do something about it, or it won't change it on its own.
Thankfully, I think slowly but surely it's getting better, but there's still this stigma over going to get help for a mental health challenge. So there's probably a lot of people that realize that they have some work to do, and maybe they even realize this is beyond what I can do on my own, but they're feeling that stigma. They don't necessarily want to go and get help from a professional.
Right.
What would you say to that person to help convince them that it's worth it and this is not something to push off?
Well, one, I would validate that, look, there's still stigma in the world, right? Like, so if you say, oh, it's stigmatized, like, that's true, right? And it's also stigmatized in the person, right? Because the guilt and shame is a form of stigma of self, right? So we could acknowledge those things, but also set them aside. Like, well, but you can still help yourself anyway, right? If you break your arm, but there'll be a stigma, right? It's like, my arm is broken. I want to go get help anyway, right? I want to take care of myself, whether maybe I'll encounter stigma, maybe not. Maybe there's stigma inside of me, maybe not. I want to be healthier, right? And I think that's what's helpful when people in positions of power in the world around us, and so Stephanie Germanato, who's Lady Gaga, wrote the foreword to my book, and I'm so grateful to her. Right? But what is she is a person who a lot of people pay attention to in the world, right? And she's a person who acknowledges her own trauma, right? Who does work to destigmatize. Who says, guess what? I have trauma too, and I have health problems that come of it. I mean, she's been public about that, right? And when a person does that, it helps people to say, okay, you know what? I admire her, right? And so if she has those problems, like I can too, right? And it's a small aspect. Like obviously the reach that I have is like so much less than hers, but in my own way, I share with people. If we're sitting one-on-one, I'll share with people in an event like this, that like I have my own trauma. And that trauma's raised problems in me. So maybe somebody thinks, oh, there's a psychiatrist who's had problems with this, right? When we're open about it, all of us, we make it easier for other people to get help, right? Now we have to be careful. We have to be careful how they do that, right? But the more open we are about, hey, this problem exists in society. This problem exists in people who we might admire from the outside. You know what kind of problem it is? It's a human problem. It's not a problem of a certain age group or a certain demographic or, a certain gender identity or sexuality or race or religion or color. It's a human problem, and it's a human problem that can be helped, right? The fact that it can be helped, like it can be made better, that's the part of it that's most powerful, right? I think another aspect of why it's hard to get help is sometimes people have tried and not gotten help. Right? They waited they were on a wait list for how many weeks before they went and saw someone, and the appointment didn't go well. And maybe that's because that person didn't do their job well, or maybe it's because that person is overwhelmed. It brings me back that we need to have helping mechanisms. We don't even do a good job of reaching out to people and saying, hey, do you need help? When like someone in their family has tragically died. How do we live with ourselves as a society? We don't think that's worth resources? Right? Look at all the things we put resources, into, whether it's the next new TV or it's, some political thing that gets millions of dollars wasted on it. Come on, we need to be better stewards of our resources and just better people in the world from the perspective of common sense. Like we got to be able to build some mechanisms up so somebody who has a traumatic loss doesn't just go home to deal with it and maybe there's some follow-up phone call. That's what happens a lot of the time. And to me, it calls for soul searching as a society of, yes, let's destigmatize. Well, let's make it easier for people to get help. Let's not say, you know what, you can get help, but boy, you got to swim against the current to do it. One, how is that humane? How is that good for us as a society? Even if we just think about dollars and cents, right? How many people who I've seen in my career where look, the insurance they have or the systems around them could give them some real trauma work. They could go away even for maybe a person needs like a couple weeks of residential treatment, and then they need a psychiatrist weekly and a therapist weekly, and that costs some money, right? So they're not going to get that. They're not going to get that, right? Not all the time, but most of the time, they're not going to get that, right? So then what happens is, well, maybe now they're in the emergency room 5-6 times. Right? Maybe they have a suicide attempt. They're in the intensive care unit, right? Maybe they're on 7 medicines now, all of which ends up costing vastly more than just having done the right thing in the first place. We live in the old penny wise, pound foolish, and I've seen that more times than I can count. It's like I'm figuring, sometime I saw that happen. No. That happens over and over and over and over again. And then we actually spend much, much more money as a society. And what happened to that person's productivity, right? They're in the hospital. They're not working, right? What's called presenteeism. They're at work, but they can't work because they're distressed. It costs us so much. So even if we wanted to think, hey, let's just think in dollars and cents, which unfortunately a lot of the systems do, it still makes sense to take care of people and to take care of their trauma, even if we look from a perspective that doesn't actually care about them, right? Let alone if we look from the human perspective of we want to reduce suffering, right? We want people to have better lives. We want people to be better parents. We want people to be better in the society around us. But even if we don't care about that and we just care about dollars and cents, it still makes sense to change the helping resources we have available for people and how we link people to those resources.
It's a win-win all around.
Yeah, and obviously so. And I think obviously so. But to your point, maybe a half hour ago in the conversation, how do you make that obvious point if we're sprinting ahead as a society, right? It's like, let's say there's something you want to tell me and it'll really help me to hear, right? Really help me to hear. But it's going to take a little time for you to tell me. You got to talk to me for 10 minutes. And you and I are sprinting as fast as we can. We're desperately sprinting. Like you can't tell me and I can't hear, right? And that's what goes on in our society. We're sprinting ahead and we don't stop and look, wait, where are we being penny wise and pound foolish? What are we doing with our resources, right? If we don't stop and look at that, well, we won't change it.
To this point, we focused heavily on trauma, how to detect trauma in your own world or people around you, and then conventional and newer ways to go about healing that trauma. But where I want to go now, and this is something we touched on a little bit at the beginning, but didn't get into the details, how do we build up those coping strategies before the trauma occurs to prevent it, or at least when we go through traumatic events to hopefully move through them a lot quicker?
We should be educating people about all of this, about how their brains work, right? I mean, think about what you and I talked about. We're like, oh, they're logic systems and emotion systems, but the emotion systems trump the logic systems. So if something happens and I feel bad about myself, it doesn't really matter what I know about myself, right? Or that our memories change along with our emotions. I mean, some of this is pretty basic, right? We can overwhelm our coping skills and we get more vigilant and less trustworthy, or less trusting, right? And maybe less trustworthy too, maybe, right? Like some of this is so basic that this is really true. A lot of this stuff I learned about my second year after medical school in psychiatry training. And I keep thinking, I want to write a book that says everything that I needed to know about life, I learned as a second year psychiatry trainee, right? But part of what it's reflecting is my own like really infuriation that like, why did I not learn this earlier? Why don't people learn this earlier? Why don't children learn this earlier? Right? Imagine children learning about why that other kid is bullying them, right? That kid feels awful about himself or herself, right? Whatever's going on, that person is suffering, doesn't know how to handle it, so then has a reflex of aggression, right? It's not because you're a loser because that person says you're a loser, right? It's like that person is reflecting something that's going on inside of themselves where they feel like a loser, right? Like, why don't we help kids understand that? Why don't we also help the bullies, right? Because the bullies often go through life, and guess what? I've seen them in the nursing homes too, and sometimes they're still bullies. And they still feel bad about themselves the same way they felt when they were kids and became bullies, right? Maybe there's a parent at home that's abusing them or telling them, how inadequate and how awful they are, right? They have some reflex inside of them that, I have aggression in me, that I'm a little bigger than the other kids, so I can feel better if I thump them, right? Or I'm a little faster up here so I can insult them, right? I mean, why don't we educate and help people at the earliest stages of life so we don't get to the point where we're learning about this as an adult? I mean, because I went to medical school late, I was in my early 30s when I learned this stuff. And I thought, oh my God, like how that could have impacted my life. And then subsequently the lives of how many thousands of people, that I've been aware of. Like, it would have been better if that person had understood earlier on. So I think, we need to assess, like, how are we guiding children? How are we educating ourselves? There's so much that's basic and obvious about how we function and how we suffer as humans that we just don't ever learn. I mean, it's the reason I wrote the book. I mean, it took a lot of time and a lot of suffering to write that book. And like, even though you say, okay, it's helped my career and this and that, sure, right? But I could never have gone through what it took to write it if I didn't feel like, look, every person who tries to get the word out there about what I think is these obvious truths in front of us is trying to put out into society something that should already be there but isn't.
And when it comes to building resilience, building these coping strategies or ways to cope with trauma beforehand, how big of a piece do you feel self-care is? Doing things like, eating a healthy diet, sleeping enough, getting enough exercise. We could go on, but having these pillars in place to build a healthy mind, to be able to move through trauma and hopefully do that in a healthy way as things come up.
Yeah, absolutely. The self-care is so important. So as you said, diet, exercise, sleep, right? The basics of coping, right? Of being aware. Who's in my life around me? How do they impact me, right? Gosh, is that person like that's kind of always negative when I'm with that person? Or, I always feel worse about myself then, right? Is some of these basics of self-care are in the service of prevention. So if I'm getting enough sleep, right? I don't have people around me who are like angry or miserable, or people who are always make things worse when I'm around them, right? I'm trying to be careful about that. I'm not in job settings where I just feel it's awful and I feel sort of oppressed in them. Like, if I'm like, look, let me look at the basics of my life of self-care in terms of physical health and mental health and relationships. We go a long way towards prevention if we're already strung out with stress and poor self-care and lack of sleep, and we're just barreling ahead with what's in front of us, the people, the places, the things, then boy, we set ourselves up for when trauma does come our way, or if or when it does come our way, but then the seeds of it fall in fertile soil. And the physical health prevention, the mental health prevention, having better coping skills, realizing, hey, if I get stressed and I have an extra drink, let me look at that now, right? Before I have lots of stress and maybe have 10 extra drinks, right? So there are ways that we can engage in prevention with the idea that, look, stressful things are going to come everybody's way. And that doesn't mean that trauma that changes our brain as we move forward is going to come all of our way, but boy, it comes to a lot of us. Right, but stressful things certainly come our way. So even if we think we're not going to have the big trauma, which we don't know, right? How we handle stress is so important to what happens when there's more stress, right? So this, I think, what you're saying is what's in the service of prevention is look at our coping skills, look at our defense mechanisms, look at our self-care, look at what we tolerate or what we wish to be in the world around us that isn't, right? And then start working towards that. Like, there's so much we can do in the service of prevention that we most often don't do.
Paul, really enjoyed the conversation. So much in here for people. And what I really appreciate about your work is you're not just addressing the problem, you're giving people hope, you're giving people tools. And the book is just super impactful. I really loved it. Loved our conversation. We're going to link up the book, link up your social media, everything in the show notes. I want to thank you again for coming on the show. Thank you.
You're very welcome, and I appreciate you having me on. Thanks so much.
Now that you're done my conversation with Paul, you're going to want to stick around and catch my chat here with Gabby Bernstein, where you're going to learn even more about trauma. I'll see you over there.
And by that point, I was so surrendered because I'd hit such a huge bottom. And my therapist intervened and sort of put her foot down and said, we got to get some more support.